My name is NURIN AIZAL.
Hi, Assalamualaikum. My name is Dayana.
Hi, my name is ARIF.
Hi, my name is Dayana.
Hi, my name is PARAMESSWARAN, son of KUMARAGURU.
And I'm from class 4 RAZZI.
I'm from FARDZI.
I'm from RAZZI.
And I am from FARDZI.
I am from RAZZI.
Today we are going to talk about 5 types of diseases,
which is hyperthyroidism,
Hypothyroidism,
Gigantism,
Dwarfism.
Hyperthyroidism, also called overactive thyroid, is when the thyroid glands make more thyroid hormone than your body needs. It causes by grave disease, inflammation, too much iodine, too much thyroid medicine, and non-cancerous tumor of the pituitary gland. And the symptom is weight loss despite an increased appetite, irregular heartbeat, nervousness, irritability, trouble sleeping and fatigue, shaky hands, and sweating. For treatment option, there is anti-thyroid medicine. For the pros, they can cause the thyroid to make less thyroid hormone, and the cons cause side effects including allergic reaction, a decrease in number of white blood cells in your body, liver failure. Next is iodine therapy. Pros, they slowly destroy the cell of the thyroid gland that produce thyroid hormone and easy use for women who are pregnant. Next is thyroid surgery. If for treat people with large goiters or pregnant women, goiters or pregnant women who cannot take any anti-thyroid medicines. The thyroid hormone, for the pros, the thyroid hormone levels may return to normal. For the cons, requires general anesthesia, which can cause a condition called thyroid storm. Thyroid storm is a sudden, severe worsening of symptoms. Taking anti-thyroid medicine before surgery can help prevent this problem. And how to overcome? Healthy diet, low iodine diet, food to avoid, iodized salt, seafood, dairy products, high amount of poultry or beef, high amounts of grain products.
Hypothyroidism. What is hypothyroidism? Hypothyroidism is a common disease where the thyroid doesn't create and release enough thyroid hormone into your bloodstream. It happens when thyroid doesn't create and release enough thyroid hormone into your body. So this makes your metabolism slow down and affecting your entire body. So what the cause of hypothyroidism? The common causes is Hashimoto thyroiditis, radioactive iodine treatment, thyroid surgery, radiation surgery, medication, and lastly, iodide deficiency. The less common causes is pituitary disorder, congenital disease, pregnancy, feeling tired, fatigue, experiencing numbness and tingling in your hands, having constipation, gaining weight, and lastly, having dry, coarser skin and hair. The symptoms are a low body temperature, anemia, heart attack, confusion, and coma. So, how is hypothyroidism be treated? Hypothyroidism is treated by replacing the amount of hormone that your thyroid is no longer making. This is typically done with a medication called levothyroxine. This medication helps to increase the amount of thyroid hormone in your body produced, evening out your levels. Continuously take medication to normalize the number of hormone in your body for the rest of your life. Then, you need to follow up appointment with your healthcare provider to make sure your treatment is working properly. You can lead a normal and healthy life.
Wow!
What is gigantism? Gigantism is abnormal growth due to an excess of growth hormone during childhood. The cause of this disease, gigantism is very rare. The most common cause of too much growth hormone release is non-cancerous tumor of pituitary gland. Other causes include genetic disease that affects the skin color, pigmentation, and cause benign tumor of the skin, heart, and endocrine hormone system. Genetic disease that affect the bone and skin pigmentation. Genetic disease in which one or more of the endocrine gland are overactive or form a tumor. Genetic disease that form pituitary tumor. Disease in which tumor form on the nerve of the brain and spine. There are many symptoms for this disease. There are abnormally tall stature, abnormal growth of the face, hand and feet, thickened facial feature, irregular menstrual cycle, excessive perspiration with light activity, delayed puberty, double vision, deafness and headache. There are many treatments. The first one is safely controlling growth hormone and insulin-like growth factor, controlling pituitary tumor growth, reducing the effects of pituitary tumor on nervous structure such as brain tissue and optic nerve, treating or reducing the effects of growth hormone on other body system, surgery and radiation therapy. Okay.
What is dwarfism? Restricted growth, sometimes known as dwarfism, is a condition characterized by unusually short height. There are two main types of restricted growth. The first one is proportionate short stature, PSS. It's a general lack of growth in the body, arms, and legs. The second one is disproportionate short stature, DSS. This happens where the arms and legs are particularly short. Causes of PSS. The most common cause of proportionate short stature is being born to small parents, but it's sometimes the result of the body not producing enough growth hormone. Causes of DSS. A rare genetic condition called achondroplasia is the most common cause of DSS. It causes poor bone growth, resulting in short upper arms and thighs. It doesn't always run in the family. Many children with achondroplasia have parents of normal height. Symptoms for PSS. Growth hormone deficiency is a relatively common cause of proportionate dwarfism. It occurs when pituitary gland fails to produce an adequate supply of growth hormone, which is essential for normal childhood growth. Signs include height below the third percentile on standard pediatric growth charts, growth rates lower than expected for age, delayed or no sexual development during teen years. For DSS, an average size trunk, short arms and legs with particularly short upper arms and upper legs, limited mobility at the elbows, an adult height around 4 feet, that is 132 centimeters. How to overcome? Well, there is hormone therapy for individuals with dwarfism due to growth hormone deficiency. For the treatment, there are surgical treatment, regular checkups, and ongoing healthcare to improve the life quality of a person with dwarfism. Lastly, we got limb lengthening.
Kidney stone. What is kidney stone? Kidney stones are hard deposits made of minerals and salt that form inside kidneys. Causes of kidney stone: when your urine contains small crystals or forming substances such as calcium, oxalate, and uric acid, then fluid in your urine can dilute. Knowing the type of kidney stone you have helps determine its cause. Number 1. Calcium stone. Dietary factors, high doses of vitamin D, intestinal bypass surgery, and several metabolic disorders. Steroid stones form in response to a urinary tract infection. Uric acid stones, when people lose too much fluid because of chronic diarrhea or malabsorption. Cystine stone form in people with hereditary disorder called cystinuria that causes the kidneys to excrete too much of a specific amino acid. Risk factors: family or personal history, dehydration, certain diets, obesity, digestive diseases and surgery, other medical conditioning. Symptoms of kidney stone: severe sharp pain in the side and the back, below the ribs, pain that radiates to the lower abdomen and groin, pain that comes in waves and fluctuates in intensity, pain or burning sensation while urinating, pink, red or brown urine. How to overcome and the treatments for kidney stone: drink water, but drink like tea and coffee also counts. Add fresh lemon juice to your water. Avoid fizzy drinks. Do not eat too much salt. Surgery: shockwave lithoscopy is a non-invasively procedure that uses high energy sound waves to blast the stones into fragments that are then more easily passed out in the urine. In ureteroscopy, An endoscope is inserted through the ureter to retrieve or obliterate the stone. Rarely, for very large or complicated stones, doctor will use precautionous nephrolithotomy or nephrolithorexy. Thank you.